Welcome, everyone. This is the second in a two-part series on environmental justice. And for those of you that joined us last week, we talked in broad terms in defining environmental justice. And today we have the pleasure of inviting and having Dr. Catherine Feaga speak to us more specifically about her work with EJ communities on the ground. I also want to thank the Alliance of Nurses for Healthy Environments for partnering with the Mid-Atlantic Center for Children's Health and the Environment. Ruth McDermott Levy, Dr. Ruth McDermott Levy is co-director with me at the center at Villanova University College of Nursing. And we've had a long ongoing partnership with Annie and are grateful for their willingness to work with us. Oh, and Hannah's got a little chat. Please add questions or comments in the chat box. So I'd like to go ahead and introduce Dr. Feaga, who is Director of Osteopathic Education and Obstetrics Coordinator for the Emeritus Family Medicine Residency Program. She received her medical degree from West Virginia School of Osteopathic Medicine and completed her residency in family medicine at Maine Dartmouth Family Medicine Residency in 2013. She practices full spectrum rural family medicine, including non-operative obstetrics, and has been teaching family medicine residents since 2014. With an extensive background in integrative medicine and a holistic approach to patient care, Dr. Feaga enjoys helping patients reverse chronic disease and regain and maintain their health. She is passionate about osteopathy and particularly enjoys discovering the nuances of cranial osteopathy and biodynamics. Dr. Feaga is board certified in family medicine by the American Board of Family Medicine and in integrative medicine by the American Board of Physician Specialties. She's currently pursuing functional medicine certification. And just as a side note, I met Dr. Feaga, as did Dr. Katie Huffling, a couple summers ago when we worked with a community in West Virginia around the building of Rockwool, which is you'll learn more about it in Dr. Feaga's presentation, but there was a gathering of community to discuss the health hazards related to this particular industry that was being built in their backyard, literally. And so without any further ado, I'm going to hand it over to Dr. Feaga. Thank you for joining us.
Hi, thanks for that great introduction, Laura. I'm Catherine Feaga, and it's a pleasure to be here with you all today. I'm a family doc and a mom of a 5- and a 7-year-old who just started school yesterday, so fingers crossed that will go well. And I work with amazing nurses every single day, and we definitely could not do our jobs without the wonderful nurses that we have. So I'm very honored to be speaking with you today. I'll be talking a little bit about the project that we worked on, and I'm going to screen share here, and hopefully that will show up well for you guys. Okay. This really came out of, I think all of us, hopefully in our lives, have experienced a sense of place and belonging, and a desire to kind of fight for our kids and our future and our where we call home. And so this was something that was really just born out of that. And where I was working at the time was at a 25-bed critical access hospital in Eastern West Virginia. And, you know, we really were the healthcare for the county. And we just had an intense feeling of, you know, if we didn't solve the problems, nobody else was going to do it. And so when this all came up, it just felt like an extension, I think, of both professionally and personally, something that just needed to be done. So I'll talk a little bit about that. And the goal really is to give you a context to think about projects or work that may need to be done in your own communities, and then where you could partner. And I'd be happy to make time for some questions at the end. So just a second here. Okay, so let's see. So in 2019, Laura already mentioned that we had sort of a realization as a community. Let me make sure I can advance here. I have nothing to disclose, sorry. So objectives for the talk, just understanding the aims and the objectives of the study, why we're setting SMART goals, and how that will help us to succeed and identify ways in which a local community can play an important role in scientific studies such as this one. So just a little introduction into what is Rockwool and what is mineral wool. It's a type of insulation, and this particular company it's a Danish company. It's only their second facility in the United States, and it's the third in North America. It's a sort of it's a type of insulation. They basically heat rock super hot and then spin it so that it forms a sort of cotton candy type consistency, and then package it in bats, and then that's sold to construction sites and that kind of thing for use as insulation in buildings. The way in which it arrived here was concerning for I think it really got everybody in the community rather upset very quickly, and partly because our state, we're an extraction-oriented state, so West Virginia, and I think the state has a fair amount of experience in how to get something done that they want done. So, and I don't know, I would like to give goodwill, I think, to the folks that did bring it here. I don't think they completely understood maybe what they were bringing, but they should have. So this was brought sort of in secret. Folks signed a non-disclosure agreement, with our development authority, and there was a code name and on all this stuff. And really the goal, it seemed, based on evaluation from the community, was just probably to slide it in before folks realized what was happening. And there was a lot of money offered, and not, 100 jobs. I don't want to say whether it was worth it or not, but 100 jobs. So we're in a county of 60,000 people, 55,000 people. So it's something, but not a huge amount. The land that was identified, it is close. I think this is really attractive because we're close to urban markets. We're only 70 miles west of Washington, D.C. and Baltimore, and we're right near some major interstate highways. And so, from a manufacturing standpoint, it's definitely an attractive location. But there was a lot of oversight of the well-documented and well-known environmental aspects to the land there. And so there's a large sinkhole concentration here. We're karst geology. And so what that means is that the groundwater will directly communicate with the drinking water below. 80% of the county's on wells. We also have frequent inversions and calm wind days. So air dispersion through stacks is not very effective. A lot of it just goes right up and comes straight back down again. And then the location of the schools and the location of the factory were, so in West Virginia, you cannot locate a school next to a factory, but you can locate a factory next to a school. And so that was sort of what we fell into. And then, and just to give you some context for the county, it's predominantly agricultural. There's horse racing strength here, and then tourism. It's tourism driven. And then, just incidentally to note, there were some errors made on the initial application that would have qualified this for additional review with the EPA, and that was not done. So there were some things that, whether they were intentional or not, definitely slid this in underneath of even rules that would have otherwise captured it and required more investigation. So, and then what you're seeing on the right-hand side is just the concentration of sinkholes in the county, and the pentagon there that's blue is the site of the facility. You can see the sinkhole concentration there is very high. And they've had 20 some odd sinkholes open up since that time, since they started manufacturing and building. Okay, so just to give you a larger perspective, we are 70 miles west of Washington, D.C. and Baltimore. And this is a picture in the background of what the mineral wool bats look like once the product is spun. Let's see here. Today, I wanted to just talk about things in the framework of SMART goals. So that would be specific, measurable, achievable, realistic, and timely. And I'll try to formulate the aspects of what we've done into that framework. So I hope everybody here is familiar or has at least heard of the SMART goals. And then just to give you an idea of what are some of the more specific like questions that we want to be asking. And it's just a good place to start. So I was blessed that Patricia Stevenson, who was an excellent nurse, put together something called an air quality symposium, which brought a lot of really wonderful scientists and clinicians out to our area and got us all together. And so one of them was a PhD from West Virginia University, who is an expert in air pollution and air quality. So at the time of that meeting, we started brainstorming about what were some things that we could do, because it is, with a county that is rather agricultural, there's not much heavy industry here at all. And this is going to be a polluter that's a real heavy polluter. So it's second largest polluter in the state of West Virginia, and West Virginia has some heavy polluters. So this was a good opportunity as a scientist to say, okay, if it's coming, okay, if we can't prevent it from coming, then what can we do to measure it? Because one of the most frustrating things I think of as a clinician is, number one, obviously advocating for our patients, especially those with risk factors, adverse childhood events, social determinants of health, all of the things that stack up upon each other and make it really difficult to ensure a reasonable quality of life. And when you have a chance to say, hey, here's potentially a big piece of that, if we don't measure it, it's as if there is no recourse. It's as if there is, it's not, these folks lose their voice. And I think as a family physician in particular, and as nurses, we all are constantly advocating for our patients, and we really want them to have the freedom of choice, most importantly, and without any type of data, there really can't be accountability, and you can't really have choice either, because you don't know what you're choosing from, you don't know what your choices are, and whether you need to make the choice or not. So measurement would provide us with all those opportunities. So it became pretty obvious quickly that we wanted to do some measuring. And then it's a question of, okay, let's think about this specific goal, and is it achievable, right? Is it measurable? And those are questions that we started asking very quickly. It's like, okay, what are the different ways that we can measure, an environmental impact and whether it have impact on people? At first, we just wanted to look at people. And so then you can kind of ferret things out into 3 different categories. And I'm blessed to have a husband who's an environmental scientist and a PhD, and kind of helped us think through some of these problems. And we have some just incredible scientists here in the Eastern Panhandle, and in our community, we're very lucky, very, very lucky. And so there's a lot of USDA is here, the Fish and Wildlife Service, the National Park System. So a lot of those bring in some great scientists. And so we thought about water, we thought about soil, and we thought about air. And water, we knew was, based on discussions with our hydrologists, was going to be difficult to analyze and difficult to measure. And then soil was going to be very labor intensive, and the costs for analysis were expected to be high. But they're considerable. We could certainly think about using them. And then air, so air, the samples are easier to collect. And then we happen to have Dr. McCauley, who's at WVU, is our air quality specialist, happened to have 3 high volume monitors that were just sitting in his office. So that was definitely attractive, because I think those can cost about $25,000 so a piece. And then we also wanted to make sure that we were studying something that was pretty clear, and with additive effects, environmental effects, it's very difficult many times to tease out whether there is truly, an impact or not, because there's so many sources, right? The signal to noise ratio is pretty low. So you want something that has a high signal of information, and heavy metals really has a lot of data behind it. And this is a facility that we knew, based on the air permit, which you guys will see here in a minute, was going to put out a fair amount of that. And so we thought, hey, maybe this could work. And so that's where we really started to distill our hypothesis and our ideas for measurement down. And that was only through meeting with a variety of different folks. And so having someone who's well connected, like a nurse or a family physician, primary care physician, somebody that is on the ground seeing folks, all different walks of life, all different skill sets, it's really, really helpful, because you know who you want to talk to find out information. So I think we're well poised as advocates for our patients, and working with our patients and different folks on a daily basis, that we can really be helpful to this type of need. So firstly, specific, what do we want to do? We want to measure to see if there are any negative effects on the health of the children in the surrounding area, the Rockwool plant, once the Rockwool plant begins operation. And we chose children actually on advice. We had actually talked with a lawyer early on, someone who had successfully litigated against DuPont in the state of West Virginia. So it was helpful to frame what we were looking for, because we also wanted to know that the data we were collecting, if there were to be a difference, if there were to show an impact, that would be something that our patients, that our family, that our friends, that the folks who are affected would be able to utilize in recourse. So we didn't want to go through all this work to only find, oh, well, the monitors weren't significant in terms of their, what their quality of measurement, or, some issues with chain of custody or those kinds of things. So we really were driven to do this correctly, just from a scientific perspective, and then as well for other reasons. So children are, for better or for worse, rather pristine, and they tend to be strongly affected by environmental pollution. So we all know this, especially from Laura's excellent talk last week. So they're kind of an ideal source for study. So just to give you an idea about the location too, we do have about 30% of the public school population within 3 miles of the site. And you can see this up here in the red circle on the upper right-hand corner. That's North Jefferson Elementary. And so that's a Title I elementary school that is located essentially across the street from this facility. And then actually, my husband would be proud. I'm using his map. It's a wonderful map that he had generated, but it really shows you, the radius there. And we didn't include the Berkeley County information here on the left-hand side, but that's generally considered to be upwind. And so what we're looking for is downwind. So we know we're going to do air. So then the question is, well, who's going to be impacted, and what distance do we need to measure from the site? And so this is where the errors or omissions in the air permit to the DEQ/EPA were important. So in environmental science and in air science, you can build a stack, and if you want to disperse those pollutants, you want to kind of get them out so that they spread out in sort of a lower concentration so that no one area is heavily impacted. You really want to kind of spread that risk, spread that impact over a large area. And so building a stack, smokestack that's of a certain height, there's modeling that basically can model. Now, this is supposed to, by the EPA, this is actually supposed to be data that's collected in real time at the site of where this is supposed to, where these factories are built. But because of the way we do things now, very few people collect real data, real site-specific data, and they actually use modeling instead. And modeling is only as good as the data that it's using as a baseline, and it's only as good as the person that's doing the modeling and checking for problems. And so, so the plan had been to build 210-foot stacks in order to disperse the pollution, but the application revealed a pretty critical error, which is that in 2% of times, 1.7% of times actually, the wind speed is 0 miles per hour. That was assumed to be, everything above that was assumed to be valid for the model, but the model itself actually is only good for wind speeds above 3 miles per hour. And so what we noted was, you see it on the left-hand side here with, it says a 24-hour period. And this is data from the closest location that we have data, which is about 12 miles away in Martinsburg, West Virginia, a little different because there's a large valley there instead of sort of more narrow valleys where we are. But you can see the data there that everything has been lumped from the 0 to 3 miles per hour. And you see that 30% of the time are calm winds. And so the stack height doesn't matter because everything goes up and it comes straight back down and the modeling falls apart. But when this was submitted to the DEQ and to the EPA, they submitted it saying, oh, it's only 1.7% of the time. So it's a big problem, a big error. So when we're thinking about the way we want to study this, we want to look at what we really expect and what we know from the observations that are available. And so having someone that can look at the raw data is really helpful because they can pick up where there might be some errors in the reports and applications submitted. So we happen to have that. We're very, very lucky. And this is a wind rose, and it just shows you that predominantly the winds come from the west, west-northwest and headed to the east-southeast, although that really changes different times of the year. When it's warm outside in the summertime, the winds tend to prevail to the northeast, right over where I live and my kids are. But then in the faster winds, the cooler winds, they tend to prevail into the east-southeast direction. Okay. So this is all helpful. And so then the other thing that we knew that was going to help us when we were looking at air, we're trying to decide soil, water, or air. The other aspect that happens here is something called inversions. So not only do we have low wind speed for 30% of the time, that's going to essentially destroy any type of dispersion model for the stack height. We also get inversions, and inversions are essentially where a warm air layer essentially traps the colder layer underneath, and what happens is that then traps the pollution or wood smoke from the stoves or air, car pollution, any type of particulate matter. It's going to trap it down. So that also too is going to increase, right? We've got a school across the street, so old school, it's like, okay, well, what's the the air intake, what's the air purification going on in that building? And then kids are going out for recess, and they're going to be playing, and they're going to be sensitive, they're going to be exposed to presumably some of this particulate matter. So just, in case you're curious, this was something that's really helpful to have, and you can access a lot of this data. Matter of fact, the Federal Release of Information Act, or the FOIA, FOIAing documents is something that the community has done a phenomenal job of. And if there's always jobs for every different type of person. And there's some folks that are just very detail oriented and they can do that tedious work, and it is invaluable. So you want to get a hold of as much of these reports and data as you can. And then you have folks that are qualified to review them, scan through them and look and say, hey, okay, what is this? Oh, this is interesting. What's this about? And so here's the air quality permit notice, and this is projected, so it's not measured currently, although we're, certainly could measure it. But you can see the really high tonnage of ozone, which it really gets trapped under inversions, and then formaldehyde, 67 tons per year, known carcinogens. So this is kind of what we're going off of. And then this is they did build the facility, which we started all this before ground was even broken. We started our plan for our study before ground was even broken. But since then, the factory's been built and it's now been in operation since May. This is one of their, I think it's their melt furnace. So knowing that, the inversions, looking at the air permit and knowing what are the what are the pollutants that we're going to be dealing with, and knowing this issue of the error that was made on the air permit application, and gosh, that's gonna not be great for the air quality here. Well, the others, I think they were a little tricky. I'm pretty sure this was intentional. They chose a baseline air monitor station for PM 2.5 that was like 150 miles away up on top of a mountain to the western part of the state of Maryland. And when you do that, you are saying, oh, look, it's no big deal that we're going to be adding all these pollutants because the air is so pristine. Well, the air is not so pristine, turns out, and I think that was a big eye opener for a lot of the community members, is saying, what's our baseline air like anyway? And this is, I grabbed a screenshot from, it's kind of the worst of the worst here, but this was back over Christmas time. And we just had this inversion and it stuck around the whole East Coast for 2 weeks, I think it was. And look at the air quality index, terrible. And this is right here, in this agricultural, rural county in eastern West Virginia. So add a bunch of that to the mix, and you're gonna, obviously have some kids with some asthma exacerbation. So that's the hypothesis, right? Okay, so get into the study specifics. The next step that you want to do is look and do a literature review. So if you're able to partner with some scientists, some PhD scientists, that is excellent. As a matter of fact, looking to your land grant institutions, so the state universities, that's a great place to start. And what you want to do, then what they'll do is look at the literature review, because you're going to ask yourselves, hey, we want to get this published, right? We want to get this published. If we're going to be working with all these different stakeholders, and we're going to be working with folks that do, science, and they're not necessarily clinicians or, working with patients, they're going to want a publication out of this for sure, and to partner. And we need, we're going to want funding. And so the way to do that is to certainly have something that's publishable. And so you're going to do a literature review. And so when you look at literature, so this was also something that informed our study. So when you look at the literature, there's very little, very, very little on the issue of blow off of stacks. So in sort of the ambient air. So there's the issue of, what's coming out of the stacks, but we know that's, modeling is an issue. But when you look at when you do a literature review, you find that these piles that they're going to have uncovered of raw materials sort of piled all over the site, they're uncovered. And when wind blows, it's going to blow this particulate matter all around. And we've got a close proximity to schools. So here's something where we can contribute significantly to the body of evidence, scientifically. And so this is going to be something that's going to interest your scientific colleagues. And so it's something that you want to be thinking about. Hey, is this novel? Is this new? Is this going to contribute something to the data? Is this something that somebody would find useful or fundable. All of those things are important. So our wonderful PhD scientist, Dr. Michael McCauley at WVU, put together these specific aims and hypotheses, and really looking at the blow off from the piles. And then looking at, say, ambient air levels of trace elements, and related to the handling or storage of stockpiles of raw materials within a 5 mile of the downwind direction, as compared to the upwind, or what we would call control. We expect that there will be a measurable change in the trace elements in the air once they start stockpiling the raw materials. And then, do we see a correlation in children that are living or schooling within that 5 mile radius around? So do we see an air uptick in heavy metals, which is what we decide to look at? And do we see a simultaneous uptick in heavy metals in kids? So that's helpful, right? You can see the correlation that might exist there. And there's other aspects of data gathering that we did not incorporate initially, which we have now with electronic medical record system, is the bane of our existence, right? But that data is searchable, right? And we only have one hospital here in our county. And so if these kids are coming in, with asthma exacerbations or that kind of thing, that's all searchable and discoverable. So you can, you could correlate this data on multiple levels. So this is actually a picture of one of their piles. And so they just drive these, front loaders into this, scoop it up, take it on out. And we don't really know exactly where their rock is coming from. And there's some concern about, there's a lot of fracking that goes on in this state. And there's some concern about contamination with other really potentially dangerous materials or radioactive materials that are part of a normal part of the underground rock and soil, but potentially have the potential to be concentrated or put into the air. So the goal for us is that we really felt like we needed to get some good funding, and it's kind of a difficult climate right now for that. And so we thought, well, if we can manage to gather some baseline data, we could really give ourselves a stronger leg to stand on when we apply for a grant. So that's really been our focus. So over the past 2 years, now COVID happened and our collection got pushed off several times, but we gotta get this done. So the initial findings are going to be, the goal is to have them used for long-term study. And So when we look at the data for what's out there in the literature, you can actually find correlations about, like, especially with OSHA type data, like what are folks exposed to, workers in these factories, what are they exposed to, what should they be tested for? And so you can see what the different factories and this process has changed very little in the past 70 or more years. So the data that's been collected is still pretty decent. So arsenic, cadmium, chromium, nickel, and lead were the main metals of interest. And so then I looked at, okay, how are we going to measure this in kids, right? We talked about we're a community group. How are we going to handle chain of custody? Because we want to make sure that the samples that are collected are able to be protected. Where are we going to, how are we going to maintain them? Do they need to be refrigerated? Do they disintegrate over time? Because we knew funding was going to be a bit of an issue for us. So we had a timeline that we really needed to meet that data collection for. So choosing something that's stable at room temperature, indefinitely, like nails or hair, is really attractive. So, and then nails, and we started thinking about the logistics of that, and oh golly, newborns and trying to clip them, and and then it's like hair's a lot easier, and so we ultimately settled on hair. And so I started looking for a lab that could provide us with analysis, and found an independent lab, and then called them and said, hey, are you willing to give us a break on the cost? Because we're going to be hopefully gathering 300 samples multiple times for you guys. So the other thing that your scientists will do is determine whether, how many samples you need in order to have something that's statistically significant. And so our aim was for 300, and we would have certainly taken more, but it takes a lot of effort to try to get folks here and up for data collection. So we didn't want to be collecting data from the human side of things that would be, scare the children, or, so we wanted something stable. We wanted it easy to collect. Easy chain of custody and all those things. So we found that in hair. And then this is just I had mentioned the literature review when you look at the occupational exposure. So you can see that, what would be expected. What are some of the metals that we would expect? So again, looking back to the schools, we, then said, okay, what are we going to compare? Are we going to look at, so if it's ambient air, are we going to look at, we want to look at real close to the site, right? Then we want to look at further out. So where are we going to draw our radius? And then how are we going to cite our air monitors? Because the goal then was to correlate that with not just students, but with the location of the air monitors. And so this is what the high volume air monitor looks like. And we initially looked to the school system because, we needed to be able to place these. There's certain requirements you really want to place them on top of a building, and with, protected, against vandalism, that kind of stuff. So putting it on top of a school would have been really great. But the politics are intense, and we initially thought it might work. And then no, everybody's, so I think, when the state holds the purse strings for a lot of what we do as society, the things that we find valuable, doing anything that would question something that the state really wanted to see happen gets people a little nervous. And so you have to be prepared for that. Most of the scientists that were willing to help us were either, Dr. Macaulay is like well established in his field, and we had several others who had retired. There was a lot of politics about it. And I myself actually even left West Virginia University, where I was working at the time. And I left to start a brand new residency program just to the north, but the timing was really good because I felt like I wasn't sure, what kind of blowback we were going to get. It's something you have to think about. So this is this is a picture of the high volume monitor. And so those were located, the goal was to locate one upwind and then one at 1 mile, 2 mile, and 5 mile downwind. And we found community members with the criteria that we needed in order to support that. So then you want to be looking at your measurability. And so for us, the air filters and the hair samples were doable, were measurable. And then this is just some of the medical impacts that we can see from some of these heavy metals. So let's see here.
That's a good idea.
And the human data, this is an example of the independent lab that will be doing the analysis here. And children are particularly susceptible. They can be helpful to study because they don't have a lifetime of additional exposures. And then also this is useful data for not just for us, for the scientists or folks that are interested in looking at correlations, but it's helpful for each individual. So the parents can make informed decisions. So this re-empowers them, which is something that was really attractive to me, because when something like this comes into your community, you can feel really helpless. And, it just is, it can be it can destroy community. And when you can give some of that power back to folks, because just in the very least that they can make an informed decision, it can really help everybody to take a deep breath. So that was one thing that I thought was really nice. So here's an example. So we put together a lot of work on this, and we went through a couple of date changes because of COVID. Here I'll show you, let's see, I'm going to skip around. I apologize for that. But this is just an example of like the Excel file that we had that was looking at who's working, who's can be doing this, who can be doing that. I wanted to make sure everybody was in appropriate PPE. I didn't want to take any chances there. So what was going to be needed, who was expected to get all of these items, you know, and what was the traffic flow going to be? So when we were doing our air collections, we had, you know, a couple of folks that were very well qualified to collect that data with the filters, and they were doing that quarterly, so seasonally. But for the data collection, that was sort of my responsibility. So this was something that we really wanted to get those 300 folks. And so we spent a lot of time planning, and we set it to, we wanted to make an accessible location. We also wanted to make it a good time of the year. We wouldn't get rained out, all of those things. And then we needed, and the community really came through to make it an attractive gathering location and time, with pony rides. Well, it was actually horse rides and you know, kid musicians, and you know, balloon animals, and lots of prizes and games, and turn something that would have easily could have been perceived as sort of a negative experience and a negative. So a lot of this has been about redefining who we are as a community, and redefining it in a positive light, which is such a challenge when you feel victimized. So taking this and saying, hey, you know, we're going to do this, and we're going to measure it, and we're going to give some of that power back to these families, and then we're going to do it in a way that celebrates community. So this was a wonderful community event. And I mean, I worked the whole time, but my kids were out there playing and listening to the music and getting, you know, little, you know, stick-on tattoos. And it just was a really wonderful experience. So I think if you can bring joy into what you're doing, that's the way to go. And that's what will attract people, because ultimately, you know, especially during the pandemic, life is stressful. So if you can bring some joy back, that's really what you want to do. So this was our sampling that took place, and this is me collecting on one of our friends' daughters, who gave me permission to use this picture. And we decided to do 2 days of data collection, drive through. We ended up with 4 consenters, 4 clippers, and then we had folks that were really important for like managing, you know, flow of cars. And we decided to just collect what we could in people's cars. Sometimes, you know, the kids were already out playing or whatever. We had some chairs lined up. We had a mom drive her 8 children in a van and lined them all up, and that was a great one that I just has a fond memory for me. We did, you know, want this to be a positive experience for the kids, and you always want to kind of distract them especially when you're gathering multiple different bits of hair from around their head and trying to, you know, bury it underneath so that no one can tell afterwards. And so we had, you know, lots of toys and little games and that kind of thing that they could play with while they were getting their hair clipped. And then the costs. And so, you know, we have up until this point done everything for essentially for very little, for under $1,000. We put ads in the local paper. I called, you know, all the local papers and said, hey, this is what we're doing, and sent a press release. You want to spread the word as much as you can. But all those stories didn't cost us anything. We did run an ad in the local paper. And then, you know, we bought independently, you know, personally, we bought a bunch of toys and stuff and we got some donations, and all the games and everything were all donated. So we utilized very little money up until this point. And then so now it's about data processing and the analysis. And we had set the expectation that it may take us 6 months to get the data processed. So we're getting ready to meet and advance that forward. And I think we'll be able to come up with the 12,000 in order to get that processed. And so that's where we are. So identify folks in your community that can be helpful, and look for the land grant institutions, look for your local movers and shakers. All kinds of folks, not just scientists, but folks that do, you know, marketing, or you know, independent retailers. They can spread word of mouth like like excellently, just wonderful stuff. So, and then I am a teacher at a family medicine residency. And so I said, hey, let's get these two medical students that are, they're always looking to be involved in something to, help improve their resume too as they apply to residencies. And so utilizing their help, they were two of our clippers. And then Dr. Gabriel, who is one of our residents, was also involved. And that's required for their residency training program that they complete projects like this at least once. So you can utilize all kinds of different folks. You want it to be realistic and timely. And so, those are the things that we aimed high. I think it's achievable, but we really want to we want to make sure we stay on our timeline and get back to continuing the air monitoring collection quarterly every season, and then decide when we want to repeat the hair collection on these kids. Yeah.
Thank you, Catherine. That was phenomenal. There are a few questions in the chat box, a couple of them from me actually, but the first one is, first of all, I have to say I'm so excited because I was on some of the calls early on, and to see how much you guys have accomplished is just unbelievable. And this presentation is so straightforward and clear about some of the on-the-ground challenges that occur, and how policy that's actually meant to protect folks can sometimes be sidestepped, whether it's intentional or not. We'll be really interested in following where this goes from here, when you determine that a follow-up hair sample might be necessary. So the first comment and question comes from Virginia Rosen, and she states, residence is in elderly, disabled, and children and pets. Former soap factory chlorinated solvents 2010 being depressurized since. However, off-gassing from refurbishing is ongoing. She developed MCS September 3rd of 2003 from common area carpet removal. No warning. MCS I experience every day, though management and HU is fully aware. Also landscapers, no PSEs. Other serious issues are ongoing. Question, who can I speak with as the BOH? I'm thinking that's Board of Health. Senator, Mass Housing, others have been inadequate. The city of Malden, Massachusetts, modified vehicles, mufflers, cylinders, and buzzsaw scooters. She resides over the Logan Airport flight pattern. Do you have any advice?
I think, looking at something that's real specific. So, sometimes just firstly, are you aware if studies are going on already? Because sometimes there are studies, and I'm always amazed when I searched for, where are the Superfund sites? Like, oh wow, that's really, really interesting. Sometimes these areas have already been mitigated or are in the process of mitigation, or there's already been some studies and data collected on them. So you can look through your local, the Department of Environment, or, environmental quality, or, the state EPA essentially, and look and see. You could call them and say, what's going on in my area? I'm in a pretty, extraction oriented state, and they're still quite helpful. So, I think you would find some help in Massachusetts. And then, the Environmental Working Group is a helpful organization. I mean, they have really great little, the easy access water quality information on your specific supplier. And then talking, if there is a, land grant university there, I would suspect it'd be UMass. because UMass Worcester, UMass Amherst, it's usually one of those big institutions, and you're looking for environmental science department, and just ask around, say, hey, who here is working on environmental pollution? And there's probably some different folks doing air or ground or water pollution. You could ask some of the local clinicians and the Board of Health. That's where I would start and find out what's already out there, because there might be something already out there, and I'm sure they would love to have your help.
All great ideas, Catherine. And I know that the Massachusetts Board of Health has been actively engaged in a lot of environmental concerns in the area, generally speaking, in the state. So that would be a good place to begin. And it looks like Ruth has a comment related to that. UMass Lowell is nearby and has a strong environmental science department. Yeah, that's a good point, Ruth. And as Catherine said, look to your local universities, particularly the land grant universities. There's a lot of work going on, and researchers that really are interested oftentimes in what's going on in their communities, and are good resources. And one of the things I do want to highlight that you talked about, Catherine, is it really does take a team to work together on this, that no one person can do it all, that there are the scientists, there are the healthcare professionals, there are the parents, there's the communities. One of the questions has to do with who designed all of the activities, the horse rides and everything. Was that a particular group of people, or just a few people that came together that decided? I mean, that's a brilliant idea, actually.
Yeah, I think there was some, there was some creative, a community. We have several different community organizations that have developed out of the concerns regarding this factory. And so one of those groups is great at doing fundraising and having music benefits and all that to raise funds, usually for a legal team or something else. And so they were on it. And we had one of the PhD scientists is one of the presidents there at the community board. So we had this, a person that was a really nice go-between. And so they had their finger on the pulse of what was going on. Oh yeah, we can get that. Oh yeah, and then when you have a community that's really behind something, folks are constantly looking for ways to contribute. So, as long as you have someone that's plugged in and says, oh, I know this person, they have the horse, as long as we can get the horse transported, then we could use the horse. And then, oh, we need somebody to make sure they have, they sign a waiver, and, it just, everybody kind of thinks it's sort of more of a group effort, and that's where you minimize the Swiss cheese holes, you get everything nice and tight.
Really a wonderful idea. I used to do hair testing for methyl mercury, and it was no fun at all. I mean, people would come in with their kids and they would get their hair tested, and it was all well and good, but there wasn't anything fun attached to it. And I think actually it's a wonderful way for people to sort of embrace the idea of testing with something that is community supported and can be joyful, right? It's we want to keep our kids healthy. We want to know what's happening, and creates an environment of coalition, if you will, and working together. Another question had to do with the form, the report back form. Did you guys create that form, or was that something that was out there already?
No, yeah, we just, so you mean that the little Excel file that I had up there, or
yeah, where it shows sort of where their range is and what's normal and.
Oh yeah, that came from the analysis company. So they'll have a sample, and then that's just exactly how it shows. So when when we send these samples off to the lab, that's what the report will look like.
Okay.
And then we wanted to make this, so this is a very contentious issue in our community, really split our community, this factory. And so we blinded our folks, our participants. And so we gave them a number and we said, you better keep this number because we are not correlating your number with your consent.
Okay.
So we have consents and they're off in a locked box somewhere, but they are not correlated with the number. So there's no way for us to correlate the results. So that parent has to hang on to that number. And so that we felt was important to provide the anonymity, which was, we felt was a barrier. There's a lot of us and them about all of this. And we just didn't want to make it about that. And so I think that's where you bringing the joy into makes it easy for folks to get behind things. So like, some of the community businesses would just, stay away from this whole issue with a 10-foot pole. And so doing something that is positive for the community, we're not making assumptions. We truly don't know what the outcome of the study will be. And so all we're saying is, hey, let's look. Let's check and let's say re-empower these folks, and so you because right now, even with the masking stuff for COVID, there's this, you can get mired in the science back and forth and back and forth and back and forth. It doesn't matter. It really doesn't.
Right.
We want our kids to stay in school. We don't want them to avoid quarantine. Start, because we all want that, right? We want to know what our kids are exposed to. We can make our own decisions after that.
Right. Exactly.
But let's find out. So if you can stay above, don't let yourself get pulled down into the hole, because folks will try to do that. And then it makes it difficult because then you draw that line in the sand and you say, well, here I am. It's for folks to take hits. So you just say, you know what? We just want information and we trust you to do what you feel is right as a parent in conjunction with a physician or whoever you want to consult about what's right for your family. So that's really what we're trying to do.
Really good points about sort of staying above, staying on the high ground, and just wanting to have the information so people can make their own decisions. One final question is from Nicole. Says, maybe you said this, so if you did, I apologize, but when are you planning on testing the hair again? And how are you handling attrition of the study participants?
I should have showed you guys when we had them come in, they signed a consent, and then that map that showed like the schools, and the relationship to the factory, actually is a grid. So that has been made into a grid, and it's 1, 2, 3, 4, 5, all the way out to 10 actually, and then A, B, C, D, E, F, G, H. And so folks would identify what section they lived in. And so that way, we're tying this data to then is that specific section of the map and not the person. So like when we look at the data, we want to see, do the folks that live in 2A, why are their numbers really high? The folks that live in 9H, well, their numbers are low. Okay, well, that makes sense. They're far away, so we just need sheer numbers actually. And, it's okay to have attrition. And that's why we wanted to collect on kids all the way up to 18. And it's helpful data for the parents to have, even if they only have one point in that study, even if they only collect the the initial baseline data, that parent can then use that information to make informed decisions. So, so it's gifting something, to parents, and it won't mess with us at all. So that's mess with our study. So it was smart. Dr. McCauley has to thank for that. He did an excellent job.
Yeah. Well, thank you.